May is National Stroke Awareness Month. WTVY's Lisa Sacaccio is sharing signs to help you recognize if someone you know is having a stroke. Lisa?
Marie, so a stroke is a brain attack that can happen when there's a blood clot, so there's a blockage in one of the veins in the brain, or when there's a bulge, and that would be an aneurysm. So according to the National Stroke Association, they said a stroke is the 5th leading cause of death, and one of the best ways to make sure that you can survive a stroke is recognizing the symptoms and recognizing them early. And when I was talking to the doctors at Southeast Alabama Medical Center, they said the best way to remember this and the easiest way is through the acronym FAST, F-A-S-T. So let's look at what each of those letters mean. F stands for facial drooping, which is when you're seeing a side of someone's face go down when they grin. A is for arm drifting, when someone holds their arms out and one starts to go back down or they can't move it at all. S is for slurred speech, someone's mumbling or they have difficulty pronouncing words. And then T is for time. Time is of the essence because during a stroke, 2 million brain cells die a minute. If you or someone is experiencing these symptoms, do not go to bed and think that you'll be better in the morning. Call 911 immediately. Now, some hospitals have flight programs for stroke patients who are far from the ER. Patients can be transferred by helicopter and then doctors can intervene as soon as possible. Southeast Alabama Medical Center, also SAMC, is part of the Wiregrass Life Flight program. They help stroke patients in Alabama and parts of Florida, Georgia, and Mississippi.
The great thing about using these air services is they have more advanced medications than the regular EMS personnel do on the ground. They have the ability to control blood pressure, titrate medications to make our blood pressure just where we want it, which is very important in the treatment of strokes.
Using FAST can help save lives, and once again, Dr. Pick stressed the key is time. When someone is having a stroke, there's a drug called TPA, also known as Activase, that can dissolve blood clots. From the moment of the first stroke symptom, there's a 3-hour window to be given the drug. After the 3 hours, Pick mentioned you're looking at surgery.
So just by the acronym FAST, we know that you need to react in a quick manner, and that time is of the essence. But what are some of the causes of a stroke?
Well, Pick mentioned the #1 cause is smoking. And then you're also going to have to look at weight and diet. Now, those are controllable things that you can manage and change. But as far as uncontrollable symptoms and factors, he says actually that women have a higher risk of getting a stroke because of their hormones compared to men.
Okay, so rehabilitation, counseling, they take a look at your diet, cholesterol.
Afterwards. Make sure that doesn't happen again.
So the grand scope of things they take a look at to help you to see what your risk factors are.
Yes.
Well, thank you, Lisa. Beneficial information. Now, tomorrow, Lisa is going behind the scenes, and she'll give you that look at neuroendovascular surgery. That's a procedure to treat strokes, and it is not offered within a 100-mile radius of Dothan.